What about strengths and weaknesses?
For my weakness, I will stick with that. I tend I like to help others,
Yeah.
but because I like to help others, it will put me behind on my own work at times.
Yeah.
I think strength.
So with the weakness, like the deal is whatever weakness you talk about, you have to talk about it like it was a past thing. And like because you know that about yourself,
Oh,
you like did
okay.
this thing that helped make sure that that is like balanced in a way that won't affect your care.
Okay.
Yeah.
So I would say because in the past, especially having to give meds to like 30 plus patients, um, that right now in the past I would have helped my fellow colleagues with their workload, but because of that, I was getting behind on my own workload. So currently, I get all of my work done, and if I have a few spare minutes, I'll ask if anyone needs help with something and let them know, hey, I have like 5 minutes. Does anyone need help with something? So that way, it's something that I'm not going to be on a time constraint with, and I can get it done fairly quickly and safely too.
Yeah. Yeah. And that kind of gives like a boundary, right? Like they know they have 5 minutes, so it better not be something that's like a 40-minute like dressing change
Yeah.
or something.
Yeah. Yeah.
um, let's see,
I
let's see.
don't really know what to say for like strengths because I guess I didn't really answer that part of the question. So
Yeah.
maybe I feel like I have really good communication, like oral and written communication at work. Um, and also I would say advocating for the patient too. A lot of patients will
Yeah.
bring up their concerns to me, especially because, like I've said, I've built trust with a lot of them, so they're able to speak to me openly about their concerns. And a lot of times they're kind of nervous to ask the doctor certain questions, so uh, I'll either ask the doctor for them or encourage them to do so when the doctor comes into the room.
Okay. Yeah, that's great. What if they
Um,
ask your hobbies and self-care?
I think hobbies, I would say I really like to go hiking. So whenever I have like some free time and it's actually nice outside, I'll take my dog and go for a hike somewhere. Or just go to like the park and just explore. Because I'm right by Golden Gate Park, so just
Mhm.
explore over there and find new areas. And for self-care, um, I try to choose like one book a month, like a fun book just to read, and take time like nightly to read that. So at the end of the day, after I get like some homework, maybe I won't say homework. At the end of the day, when I get all of the tasks I have done, then I'll treat myself to reading like before I go to bed usually.
That's cute. I like that.
So I recently, last year was promoted to a lead nurse at my job at the allergy and asthma clinic, and I've been there for about 3 years. So it's been a little bit challenging just because I've been there 3 years and most of the other staff have been there for like 10 plus years. So
Mhm.
it was a little bit challenging at first, but my staff saw that I'm hardworking and willing to listen to them and take their feedback on problems rather than just trying to solve a problem myself. I take into consideration everyone else's thoughts and get feedback from them. So that way we can all kind of make like a cohesive decision on what may be best for the office as a whole. And that's really helped us out a lot, and especially with getting us to communicate with each other and just have great teamwork too.
I love that. That's so like humble. You're like a manager for the people. I like that. Can you tell us about a time when you had conflicting priorities and how you handled the situation?
Ooh, that's a good one.
I feel like that's an easy like delegation one.
Yeah, that is. Let's see. I know I had something like that happen today, actually. So today, for example, at work, I do infusions at work. But before my infusion patients get there, I'll just help out in the back office doing other tasks. And I had a patient come in that was a little bit of a longer appointment because it was an oral food challenge. So it's over an hour long. And this was a younger patient, so it can take even longer. And I knew it was going to get into the time frame of my infusion patient. So I started the oral food challenge appointment, and then when my other patient got there, I had to find someone who could take over for me for the oral food challenge, which we don't normally like passing those on just because you have to kind of know what the patient's baseline was, like their skin assessment, if they had like a rash already, so you know what to look out for if they are having a reaction to the food. So I had written some notes down already from their baseline and had the dad take a picture of the patient's face. And I also let him know that I might be switching with another nurse, so he wasn't just thrown the idea that I wouldn't be with them. And I told him from the very beginning that I had another patient coming in and I would probably be having another nurse take over, but that I would let him know before that happened. So when my other patient got there, I introduced the dad and the patient to the other nurse covering for me. And I gave her my notes too, which luckily he had clear skin, so I didn't have to really like show her anything, but I did give her my notes just in case and let her know that dad took a picture of his face too. So I had to delegate so I could get the other patient taken care of.
Perfect. Oh, tell me about a time when you found it justifiable to break a policy or alter a procedure.
Let's see. I think today, actually, that's a good one. So today, the infusion I do, how I was trained, these infusions, it's giving people antibodies like IVIG.
Mm.
So how I was trained was you check their vital signs every 15 minutes for an hour, then every 30 minutes for an hour, and then every hour until they're discharged. And I was talking to the other lead nurse about that today, just because a lot of patients were complaining, like, why do you come in here so often? I've been doing this for like a year, like I'm fine. Like you're always coming in here to check my vital signs, and they're just getting agitated. So we looked online and saw some studies that actually showed that unless it's their very first infusion, that it's not really necessary to check their vital signs that often, unless obviously you're seeing some symptoms of a reaction. And we discussed this with the doctor too. So we ended up just changing that policy that you only have to check their vital signs like every 15 minutes for an hour on their first infusion. Otherwise, we switched it to checking it at the beginning and at the end. And then also, if they're having any new symptoms, we would check their vital signs as well.
Cool. You could also use this if they ask you like, tell me about a time when you used evidence-based practice to um direct your plan of care.
Okay.
Yeah. What if they ask like, what support do you hope for from your preceptor?
Mm, that's a good one. Um, I would hope that my preceptor is very patient, and also that I feel comfortable enough to approach them with questions because I do like to ask a lot of questions, especially if it's something I'm unsure about. And I don't want to feel intimidated by the preceptor, because I want to be able to openly ask them questions and also make sure that they're going to be giving me a lot of feedback, even if it's feedback that I may not want to hear. I know it's like necessary just so I can grow as a nurse. So I'm really hoping that from the preceptor that they're supportive and very good with their communication skills, and also that they're providing me feedback often or as needed.
Okay. You can also say, I've heard people
Mhm.
say like they would really like while they're in their orientation period for a preceptor that would show them what their resources are because like even experienced nurses learn new things every single day and like you're gonna have so many questions um your first few years that you realize you don't have to have the answer, but you have to know where to go to get the answer. So like, where do you find policies and procedures? Like, how do you reach out to Rapid or call a code stroke? Or how do you get in touch with a clinical nurse specialist if you see some kind of device that a patient comes in with that there isn't a policy on, that kind of thing.
Oh, okay. Okay.
What about clinical scenarios? So like um for if you're thinking like, well, so it's not just NICU. So NICU, I would read up on like things that happen to babies specifically, because I've been in adults for four
Yeah.
years and I like don't super remember. Like I would guess
Mhm.
like sepsis, aspiration, they have their own kind of like cardiac things going on sometimes.
Yeah.
And then for like the ED or whatever, I would be prepared for like how to work up like signs of stroke, how to work that up. 'Cause
Oh,
a
yeah.
lot of
You need to do
EDs are like
that.
really proud of their like door to needle time or whatever. Um,
Hmm. Okay.
and then what else? Like respiratory distress, seizures.
Hmm.
Um, so what would you do if you came into your patient's room and um you were just routinely taking their, or you noticed that they were lethargic, so you did a set of vitals and you saw that or you just did the blood pressure and you saw that their blood
Hmm.
pressure was 70/50 and you noticed that they're a bit more lethargic.
I would probably call for another nurse to come in and help me and make sure that they have a patent IV, because they're probably going to need like a bolus or something. Um, ooh, what else would
And you
I
only have
do?
the blood pressure, you don't have the rest of the vitals.
So finish taking their vitals and call for help from
So
another
you
nurse.
see their heart rate is 110.
Hmm.
um they're satting 92% on 2 liters. And their respiratory rate is 20 and their temp is 38.1.
Call for help, make sure they have a patent IV, sit them up in the bed, and mm, do they have oxygen on? If they don't, I'd
Yeah,
get
so
them
they're
a
92%
nasal.
on 2 liters.
Oh yeah, on a nasal cannula.
Yeah.
So maybe I would switch it. Is that appropriate to switch
We
to a
usually
mask?
titrate to 92. So like
Oh,
they're
well,
they're
that's
hanging
considered
out.
normal.
Yeah, they're doing fine for their oxygen. But their temp is 38.1 and their heart rate is 110 and their
Is
blood
that a
pressure is low.
fever? I'm not familiar with
Yeah,
my
so
Celsius
the
yet.
standard range Celsius is 36 to 38. So that would probably be like
Okay.
101, 102, something like that.
Okay. I think I would also probably try to get a urine sample. Like if we hadn't done that, I
You'd
guess
want
that would
like
be a
orders
bit
from the
later.
doctor.
Yeah, I guess that would
Yeah.
be something later.
And I feel like you would do things that you're probably not taking credit for just because it's so habit for you at this point. But you would
Hmm.
probably like see if the temperature of the skin is like um is if they're clammy or if they're like particularly they feel warm to the touch, or if they look like they're third spacing, like do they are they have more edema everywhere, like
Okay.
and they're lethargic, like you would probably be talking to them, seeing how oriented they are. And I feel like because you've been in LVN, these are things where it's like, of course, yeah, I would do that. It's like habit, but like taking credit for it because it's
You
kind of
have
a
to like,
given.
okay, so
Um,
just make sure like that's a good question. I'm gonna think about that later because I can't think of like what else I would do.
yeah. And then, like you said, like, so clearly there's likely some kind of infection. Like, that's all anybody, even like an attending physician, would know at this point, um, until they get blood work and like cultures. So you would page the doctor,
Mhm.
um,
Oh,
and
I should say that. Yeah.
yeah, you'd page the doctor and you'd say, um, BP 70/50, um, temp 38.1, heart rate 110, um, you know, please come to bedside to assess when you have a moment. Would you like lactate, CBC cultures, fluid bolus, chest x-ray.
Okay.
And then likely they'll order all of those things. And so the kind of the order that you do this in is, and the order matters because if you do it in the wrong order, it kind of screws up like the effectiveness of each step. So the first thing you do is you get the cultures. Like,
Okay.
and when you say cultures, you're doing like you said, like urine culture, sputum culture, if they can give it, like culture from any like drains that they have. I feel like I'm forgetting one,
Blood
blood
culture.
cultures. And then while they're waiting for those to like grow anything and see what antibiotics those would be in theory susceptible to, so you draw them and then and that'll give you like your white count, your lactate, all that stuff. Then you do broad spectrum antibiotics, which is usually like a Vanc or a Zosyn or something like that. And then once you have that circulating, then you hit them with the fluid bolus to not only have that like circulate, but like add back fluid that they may need because they're third spacing, and they might do something even like albumin to just like bring everything back in to where you want it. And then they'll probably just serially check the WBCs and the lactate just to make sure they're not like increasingly septic. And then they'd probably do like a Tylenol for the fever. Yeah. And then I would loop in Rapid and have them help you with that like mega order set that
Oh,
comes in, and then
because
kind
they're
of pick
meeting
their
that
brain.
criteria. That's
Of
right.
the
At the
service.
hospital. Yeah.
Yeah. Oh
That's
yeah, for sure. And then like while Rapid's there, pick their brain of like anything else that you could do
Mhm.
for this patient. And then you know, have them pass along to the next shift, like in their report. This is a patient that they have on their radar, and they're gonna kind of be
Yeah.
peeking in on their chart periodically and making sure
Okay.
that they're doing okay. Yeah. So
The
and I feel
question.
like what's that?
Oh, I was just going to tell you the question they asked me for the PICU. They asked me what I would do if I had a patient coming up to the unit with status epilepticus. So
Oh,
that was the question they asked me. Um,
what'd you say?
I told them that I would make sure that before the patient got up there that the suction was connected and working,
You
that I
genius. Okay.
had
I love
that I
that.
had the oxygen set up. When the patient arrived, I'd make sure when it was safe to do so that they had like a patent IV present already, and if they didn't, at a safe time, get one started and make sure that the area is clear from them hurting themselves. And then I couldn't think of anything else.
Yeah, you could like pad the bed rails,
Oh,
you
yeah.
could turn them on their side. You could make sure to have the doctor write like a PRN order for Ativan or phenobarbital or whatever it is they're going to want. Definitely let Rapid know like that this patient is coming in and that you might need assistance for them to please come by. Um, and
And
like
you would
let your charge
normally,
know too.
okay. Because also they're burning up like a lot of energy, right? So they might need like glucose or something. I
Glucose, and like
remember,
you would want to check their lights too.
yeah, okay. Because I remember that like the next day I was like, oh, I should have said that, but I couldn't remember if that was like
Yeah.
or yeah.
And if
So,
they ask you something where you're like, I have nothing that is coming to mind for that, you can just say, that's a really great question. I can't think of a situation off the top of my head that really pertains to that, but I'm sure I'll come up against that situation in my career. And what will be really important for me is just, and say whatever you think it is, like really focusing on maintaining the safety of my patient or like whatever.
okay.
Yeah.
You.
Yeah. They're not going to
Yeah.
fault you for that. They're going to be like, oh, well, if she was in the situation, she would handle it correctly, obviously. So we'll give her 4 points.
Okay. So
Yeah.
just kind of tell them what you would do in that
Yeah.
situation.
Like whatever
Okay.
your best guess is probably the rubric of like you get full points if you demonstrate like the ability to whatever, like
Okay.
de-escalate or be compassionate or like escalate to the appropriate team or what, like whatever you
Yeah.
they're giving you points for, just say that you would do that thing.
Okay.
All right. Well, I'll send you this recording so you have it.
Okay.
And then let me know what you decide. And then let me know if you want to send me a draft of your thank you note. Um, I can just like look over it. Um,
Oh, should I send people thank you notes? Like,
yeah, like what really helps is instead of just like the standard thing where people just talk about why they're a strong candidate, which honestly is
uh,
kind of boring to read. It's better if when you ask them like what quality improvement goals are you working on in the unit right now? Like when you ask questions or like anything that they tell you about the hospital or like what is important to them, you kind of take notes of what of that where you're like, wow, I really like that they shared that. Like, I love what they shared about like the orientation process, like anything where you feel really good about what they shared. Remember that and like mention it. Like, thank you so much for sharing about this thing. I would love to work in it sounds like this is a very supportive environment for new grads. It would be such an amazing opportunity to learn from you how to achieve this goal together. Like, because
okay.
it's kind of speaks to the connection that you made with them rather than just like, here's all the reasons why I'm better than everybody else. Pick me, you know?
Oh,